Hello, my name is Al Ali. I'm a professor of plastic surgery at UT Southwestern in Dallas. So let's talk a little bit about male breast reduction. There's two groups of people or males that present for reduction of their breast size. So one group is essentially males of any age, but they usually present younger with excess breast tissue. 70% of males going through puberty have some breast growth. 70% of those will lose it. So you end up with a small percentage of people who still have breast excess after all that excess has gone away. And this may vary from a little bit of excess, meaning just around the nipple area, to the extreme is almost C-cup breasts. The other group of patients who present with male breast excess are people who are obese and lose weight. They definitely will have larger amounts of excess, closer to female breast size in many cases. The approach to each kind of problem can be very different, from as simple as liposuction to more extensive procedures where we have to cut out the excess. Not exactly like a female breast reduction, but in a different pattern, but essentially doing cutting in order for you to get to that. I think one of the important things to consider in male breast reduction is, are you just simply reducing the breast, or are you making the chest look better, more like a normal breast or chest area in a male? So certainly you could just cut out the excess, but it could look awful. So for example, the nipple and areola, which is the area around the nipple that's colored, should never be above the border of the pectoralis muscle, which is the muscle of the chest here. And sometimes you can reduce the breast or the chest area significantly, but that nipple and areola is below that. Well, that'll never be the case in an attractive chest. So part of reducing the male chest is, do you create a more normal, more appealing chest, or are you just making it smaller? So we have expertise here that pays attention to those details, and I think all good plastic surgeons do pay attention to that as well. I think, again, the recovery period, if we're talking about that, greatly depends on what kind of procedures we're talking about. If you're doing the simpler things, the recovery is relatively quick. If you're doing more extensive things, it's probably a little bit more along what a female breast reduction would be like.